We will now be talking about the program information and policies, Section 3 of the Dental Assisting Program of Northern Virginia Community College. In Section 3, we will be talking about guidelines for exposing radiographs, and you can find that from pages 43 to 46. In the guidelines for exposing radiographs, we will be talking about full mouth surveys. Full mouth surveys is another word for saying full mouth series. In other words, you will be taking a full set of x-rays on a patient. A full set of x-rays can include anywhere from maxillary molars, maxillary premolars, the maxillary canine, maxillary incisors, mandibular molars, mandibular premolars, mandibular canine, and mandibular incisors. There are criteria for taking each type of x-ray. Included within the criteria, unfortunately, are critical errors. So if you're missing a certain aspect of the mouth and you did not capture that in a certain radiograph, those are considered critical errors. In maxillary molars, that's part of the full mouth surveys, all the crowns and roots of the existing first, second, and third molars, including the apices or roots of the alveolar crests, contact areas, surrounding bone, and tuberosity region must be present in this radiograph. As you go on into dental science, you will be learning all sorts of aspects of teeth and bone when it comes to the oral cavity. In addition, in radiology, you'll be learning a slew of terms, and you will be learning a whole different side of dentistry in regards to what these terms mean. In maxillary premolars, all the crowns and roots of these existing first and second premolars, as well as the first molar, including the apices, alveolar crests, contact areas, and surrounding bone, must be present on this radiograph. Okay. With the maxillary canine, the entire crown and root of the maxillary canine, including the apex and surrounding structures, must be present on this radiograph. In maxillary incisors, the entire crowns and roots of the lateral and central incisors must be present on this film, including the apices of the teeth and surrounding structures. As we finish with the upper teeth, we're moving on to the mandibular. In mandibular molars, all the crowns and roots of existing first, second, and third molars, including the apices, alveolar crest, contact areas, and surrounding bone, must be visible on this radiograph. In the mandibular premolars, all the crowns and roots of existing first and second premolars, as well as the first molar, including the apices, alveolar crests, contact areas, and surrounding bone, must be visible on this radiograph. In the mandibular canine, the entire crown and root of the canine, including the apex and surrounding structures, must be visible on this radiograph. And in the mandibular incisors, the entire crowns and roots of the 4 mandibular incisors, including their apices, interproximal alveolar bone, and surrounding structures, must be visible on this film. A lot of this terminology you're probably not familiar with because you haven't entered the courses yet. But this is a great go-to guide as you start radiology and as you start dental science. I advise that you go ahead and make friends with this terminology, you read over this material and get to know it such that it won't be too much of a surprise for you when you enter the courses in the fall. Another type of x-rays that will be required for you in radiology would be something called Bitewing surveys or Bitewing x-rays. These are a shorter amount of films, usually consisting of 4 x-rays. You have molar bitewings and premolar bitewings. In molar bitewings, the film must be placed parallel to the crowns of the maxillary mandibular teeth and positioned distally to include the last erupted tooth in the arch. Okay. There's a key to this in molar bitewings. You should be getting half of the second mandibular premolar. If you do not get that and you get only the molars, that is a critical error. Premolar bitewings. The film must be placed parallel to the crowns of the maxillary and mandibular teeth. There is another key element with obtaining the premolar bitewing. It is imperative that you get the distal half of the canine. Even though we are not interested in the canine, it is important to obtain that part of the tooth. And you'll learn why it is such a critical error as you enter the course of radiology. Take note of the bottom portion that's written deductions for critical errors. And there's a whole slew of them: overlapping teeth, no film mounted in the prescribed area in the film mount, or maybe you just didn't capture the x-ray correctly. Horizontal overlapping, meaning the teeth are on top of each other. The whole purpose of Bitewing x-rays are for the provider to be able to see what's going on in between the teeth. So if there's overlap, it makes it completely pointless to see a Bitewing survey. Again, you'll be learning a lot more about these terminologies and critical errors in your radiology course. Again, I recommend that you read over all this information because it again, will be a big staple in your career. Bitewings will be, I'm sure you all, when you see your dentist, you get something called Bitewing x-rays or a Bitewing survey done every year. And when you get that done, they review it to see if you have any cavities in between your teeth, okay? And that's, you know, that will help you in remembering what the Bitewing surveys are all about. But again, this is a great summary for you to review. Thank you.